Hi, thank you so much for your help with the case of Amy. As Nat Gottlieb and Handelsman 2015 state, that sometimes ethics codes are not enough, and that these issues often occur in the ethical grey zone, meaning that the codes and legislations can't always tell us exactly what to do. I noticed that Kuchar and Keith Spiegel 2016 have designed an 8-step process for ethical decision making, and I've used a slightly amended version of that process today to help with my decision of what to do with Amy. So first I framed the ethical dilemma. According to Crowder and Turvey 2013, an ethical dilemma is a type of ethical issue that arises when the available choices and obligations in a specific situation do not allow for an ethical outcome. So the ethical dilemma I have determined is competence. Is it worse for me to treat Amy even though I've never dealt with eating disorders, especially one this severe before, versus termination of psychological services? Is it going to be worse for me to terminate the service with Amy? So then I referred to the relevant APS standards and principles. So first I referred to section B.1, competence. So I need to think about whether my abilities as a psychologist are the best ones for Amy, because seeing as eating disorders, especially ones this severe and active, are outside of my competence zone, and by treating her, am I doing more harm than good? I also need to keep in mind that Amy is an Indigenous person, and I do need to think about whether I am the best psychologist to treat her in this situation. So I did also refer to the ethical guidelines for the provision of psychological services for and the conduct of research with Aboriginal and Torres Strait Islander peoples, and once again referred to Section 4 competence, specifically 4.1, which gives me the idea that I need to ensure that I am sensitive to cultural and contextual factors, and I need to seek guidance from Indigenous cultural consultants where I believe would be required in the case. And also Section 4.4, which means I need to address the impact that my beliefs and have on Amy, seeing as we do come from different cultural backgrounds. I also referred to Section B11 of the APS code, which is the termination of psychological services, which does state that if I need to terminate my psychological services, I do need to take the psychological well-being of the client into consideration as a top priority. So even though I'm not fully competent in this area, is my terminating the relationship with Amy going to be worse than continuing? I specifically referred to section B11.5, which does give me a bit of a rundown of what I would need to do if I was to terminate the psychological services with Amy. The relevant legislation I have referred to is from Victoria, as I am based in Victoria, and is the Mental Health and Wellbeing Act 2022, specifically referring to Section 25, which leads me to believe that I need to ensure that Amy's treatment is culturally appropriate for her and how her needs and experiences are affecting her mental health, especially as an Indigenous person. And also Section 18, that I do need to keep Amy's autonomy and freedom as the number one priority when dealing with this case, and keep in mind that hospitalisation may not be the best solution for everyone, depending on their specific needs and background. I then considered the values trap, so past research by both Fritz and Oz and Glover 2007 and Glover et al. 1997, sorry, has informed that personal values do play a role in ethical decision making. So one characteristic that is specific to me is that I am privileged to be able to afford healthcare and hospitalization, and that these do not affect my cultural beliefs in any way, but this may not be the same for Amy. And I also value trust quite a bit. So I understand where Amy is coming from and her feelings of anger and betrayal, and this may kind of sway me in my decision about the case. I then identified the ethical rights and vulnerabilities of both Amy and myself, which I once again referred to the APS code for. So I referred to section A.5.3, which is the informed of the extent of confidentiality at the commencement of treatment. So Amy does need to know that confidentiality does only go so far, and that if I do believe she's a harm to herself or others, I do have to report her. And also section B.1.2 that psychologists only provide services within the boundaries of their professional competence. So Amy does have the right to a psychologist who is competent in the area that she needs. And B.11.2 that when psychologists terminate a professional relationship, they have regard for the patient's well-being, sorry. So Amy does have the right that I look after her well-being, even if I am going to terminate the services. And Amy also does have a vulnerability as an Indigenous Australian, which is something to keep in mind. And my ethical rights also are B.1.2, which means I do have the right to terminate the services if I believe it is unethical for me to continue. However, I do need to do this in an ethical way. So then I came up with two possible decisions. Decision one being to continue the services to the best of my ability and try to mend the therapeutic relationship while continuing to recommend, if I see fit, that she sees someone more qualified. And decision two, to end the therapeutic relationship due to the lack of competency, ensuring to leave Amy with referrals and contacts of people who are more qualified than me. I then identified positive and negative consequences for both these decisions. So for decision one, a positive consequences are not breaking trust, continuing to build the therapeutic alliance, and ensure that Amy is receiving some care. However, the negative consequence could be that my lack of knowledge and expertise in this area could do Amy more harm than good. For decision two, the positive consequence may be that she might end up seeing someone more qualified and may end up considering hospitalization. However, the negative consequences is that she may get worse and not have anyone looking out for her, be receiving any sort of psychological help at all. She also may not have the means or funds to get help elsewhere, and it may go against her cultural beliefs, meaning she may become a lot more isolated and end up getting worse. So then my final decision was to go with decision one. So I will continue my sessions with Amy, try to rebuild her trust in me, and only offer referrals if I believe as necessary. And it means that I personally can continue to monitor her progress and know that she is receiving some help that she needs, and I can use my discretion to decide if she is getting better or not, and whether or not I should consider mandatory reporting. So once again, thank you so much for your help. It really helped me, and I'm really confident in the decision that I have come to today in the case of Amy.